Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. November is American Diabetes Month, raising awareness of a disease that affects millions of Americans. Our guests today are Julie Schema, Certified Diabetes Educator with Mayo Clinic Health Systems, and Linda Carruthers, who is a registered dietitian and nutritionist at Mayo Clinic Health Systems as well. Ladies, thank you both for joining us today.
Thank you for having us, Jason.
Well, as I said earlier, diabetes is a disease. It affects so many lives in this country. Julie, first of all, how common is diabetes?
Well, about 29 million people in the United States have diabetes. Only about 21 million of those people know they actually have the disease. We estimate another 8 million have the disease but have not been told yet. Approximately 86 million people are pre-diabetic. 1 in 3 people in the United States will develop diabetes in their lifetime.
So, Julie, what exactly is diabetes? It's a disease, correct?
Yes, it is. It's a chronic illness, Jason. It's a disease that the body does not have the ability to utilize the glucose in the bloodstream. A person with diabetes has too much sugar trapped in the bloodstream. Sugar is our body's energy. It's what our muscles use and what our brain uses to do all of its functions. A person that has diabetes can't utilize that sugar in the bloodstream. Person with type 1 diabetes doesn't produce enough insulin to regulate the glucose. A person with type 2 diabetes has developed what we call insulin resistance. And then we have ladies during pregnancy that develop diabetes, and we call that gestational diabetes.
So what are some of the health problems and complications that can occur in life because of diabetes?
Diabetes typically affects the circulatory system, and that leads to all other types of illnesses, one being increased risk of heart attack, stroke, blindness. It can lead to blindness or other visual disturbances. It can lead to kidney failure, and it can also be, it is the leading cause of lower limb amputations, secondary only to maybe a car accident or other blunt force accident.
So Linda, earlier Julie mentioned prediabetes and 86 million Americans that have prediabetes. What exactly is prediabetes?
So Jason, prediabetes is the condition that comes before diabetes. And there aren't any symptoms that are related to it. So there are many people who have it and don't even know that they have it. Statistics say that 9 out of 10 people don't know they have it, and 15 to 30% of people with prediabetes will develop type 2 diabetes within 5 years if they don't make some drastic lifestyle changes.
So how do I find out if I have prediabetes?
Well, you need to be checked. It's a blood test. Usually they'll call it a fasting glucose, fasting blood sugar, that you have to have done to know if you have it. So you can either go to your doctor or your provider, ask if you've had it done, request to have it done, and if you have the patient online services, you can actually go onto the Mayo Clinic website, pull up your lab work. You have to get registered first to use that portal, but then get registered, get on there, pull up your own lab work and be able to see what your number was the last time you had it, and then absolutely have that conversation with your provider about what your blood sugar is.
So 86 million Americans with prediabetes, that number still just amazes me. Yeah. What can those people that are at risk of prediabetes or that have diabetes, what can they do to delay or prevent type 2 diabetes?
There's 3 main categories. The first one is physical activity. And the most current recommendations are 150 minutes a week of moderate intensity activity. So moderate intensity, 150 minutes a week, so 30 minutes 5 times a week would take care of that. Another thing is to maintain a healthy weight. And we live in a society now where everything is bigger, portions are bigger, the plates are bigger, our drinking glasses, coffee cups are huge now that people drink out of. So we need to take a good check on what we're eating for portions, and is that what's really recommended? There's some of the boxed meals you can buy at the grocery store, the kind of meals where the noodles or pasta and the sauce packets are there. You add a pound of ground beef and maybe some water. And I don't think many people are really aware that one of those boxes is supposed to have 5 servings per box. And I really haven't met many people that say they get more than 3 servings. I've met some people, younger people, that tell me they eat that for a meal, the entire box. So you'd have to take all those numbers on that nutrition facts label and multiply those times 5. And those numbers would be very high for carbohydrates and fat and sodium and all of those things. So along with that, maintaining a healthy weight, besides portion sizes, is cutting back on fat and calories. That's going to help promote a weight loss, and to avoid concentrated sources of sugar. When we're thinking of soda pop, fruit juice drinks, even fruit juice itself, if people are taking in a lot of sugar, that's going to turn into blood sugar running through our systems, and that's definitely going to put us at risk or on a faster track to actually developing type 2 diabetes. And third is to take prescription medications. Some people with prediabetes may have been given a prescription by their provider for a medication that will help lower the blood sugar. We want to make sure that you are taking that if you've been prescribed that, and that may help as well hold off the actual diagnosis of type 2 diabetes.
So you mentioned concentrated sources of sugar and soda and fruit juice drinks, those sort of things. What about sweets, candies, cakes, pies, those sort of things that have a lot of sugar in it too? I'm guessing that those are also probably not good.
Absolutely. Absolutely. But people seem to eat candy more of just in maybe perhaps binge settings compared to soda pop that people are drinking all day long and just having that constant source of sugar running through the system. But actually any of those concentrated sources of sugar, so sweets and candy would be included in that as well.
And when you mentioned physical activity, moderate physical activity, what exactly is that?
They say how you can judge it is you should be able to walk while you're doing it, but you should not be able to sing. You don't have enough wind to be able to sing, but you have enough breath left to be able to speak. So that's how you know if you're doing it at the right intensity, that moderate intensity. And it can be biking, if you're not going downhill the entire way, walking, rollerblading, whatever type of activity you do that really gets that heart rate up there and you're exercising that heart in the proper fashion.
So Julie, are there any symptoms of diabetes? If someone, can they display symptoms that maybe would suspect that they may be getting type 2 diabetes?
Most of the time, patients that we work with do not have any physical signs at all. They come to us and they're very surprised that they have diabetes. And personally, I think that's one of the most dangerous things about having diabetes is that you don't feel it. You can't really feel a change. However, sometimes if it occurs more rapidly, people will come in with complaints of excessive thirst. And this is a thirst that is very difficult to quench. You drink and drink and drink, and unfortunately people may be grabbing sodas to quench their thirst, which is really adding fuel to the fire. If you're drinking like that, then you're going to be using the bathroom more frequently. And then there are some people that will come in to see the doctor and complain of unexplained weight loss. And that's due to a person losing a lot of the sugar through their kidneys, through their urine, and they're actually urinating out a lot of calories. So they're losing weight, but they can't explain why. They're not exercising more, reducing their calories.
So really it's a matter of being aware that you may be at risk and then checking with your healthcare provider.
That's correct. That's correct. We really encourage at least a yearly physical that will include a fasting lab test. Most frequently, doctors will run that now as a routine lab work.
So what is an insulin shot? So I've heard with diabetics they have to take an insulin shot. What is that, and why can't diabetics just take an insulin as a pill?
Insulin cannot be ingested through the mouth and enter the stomach yet. I know they're probably working on something like that in years to come, but insulin is a protein, much like a hamburger or any other protein. It will be digested in the stomach and it'll never reach the bloodstream. So patients that require insulin need to use a syringe or an insulin pen, or some people even wear an insulin pump, and that delivers the insulin just under the skin into fat tissue, and then the insulin will find its way to the bloodstream where it can do its work from that point on.
And the purpose of the insulin shot is to what?
The insulin is a hormone that regulates the amount of glucose in the bloodstream. I always explain to patients that insulin will escort blood sugar to a cell, a muscle cell, to be burnt as energy Insulin is our body's gasoline, so we need to have it. So insulin brings that glucose molecule to one of millions of tissues in our body. Insulin also will take what's left over at the end of the day, the extras, and store that as fat.
So why do diabetics have to check their blood sugar so often? And what are some of the tests that they do that with?
Some of the tests that we use, one is called the hemoglobin A1C, and that's a blood test that's ran at your doctor's office about twice a year. And that gives us a background of the general control of how a patient is managing their diabetes. A patient is also asked to test their blood sugar at home with a home monitor. And after working with their doctor or diabetes educator like myself, we would set up a program for them and explain to them when are the best times to check your blood sugar at home, what time of the day will give you the most information.
Can you explain what diabetic shock is? I've heard of that term. What exactly is that?
Well, I mentioned earlier that glucose is our body's gasoline. All of our muscle tissue requires a constant source of glucose, much like a conveyor belt. Our brain is no different. It needs to be bathed in glucose 24 hours a day, 7 days a week. If too much glucose leaves the bloodstream, our brain kind of goes into a shock. It doesn't have the nourishment needed to continue normal processes.
What are some of the risk factors for diabetes?
Some of the risk factors would be a family history. Mom, dad, brother, sister, grandma, grandpa that have diabetes. If it's often very genetic. It's passed down through the family tree. Being older than 45 can raise your chances of developing type 2 diabetes. Having certain ethnic background, African American population, Pacific Islanders, Asians, American Indians, they run a tendency to run or develop diabetes much more than other populations.
So Linda, back to you. Your specialty is nutrition. And as a dietitian, you work with diabetic patients quite a bit, I would imagine. For folks that maybe have some of those risk factors, diet-wise, are there certain things that they can be doing to maybe either delay or prevent diabetes from occurring?
Those same things that we mentioned before, looking at weight loss if they need to lose weight. And anybody can pull up online the body mass index or BMI chart. And it looks at your height versus your weight, and it puts you in a category. So you can see if you're in the normal range, overweight, or obese. Look at that body mass index and determine if losing weight would be a benefit, because it absolutely would. Like Julie said, the more fat a body carries, the more resistant those cells seem to be able to use the insulin. So to look at ways you can lose weight, and one thing that ties nicely into losing weight is exercise. So when anybody comes in to see me, whether it's for prediabetes or diabetes, we always cover both of those areas, healthy eating, exercise, and for activity, just moving more. Buy a pedometer, and it doesn't have to be an expensive one. Some people like the more expensive ones, but purchase one of those and aim for 10,000 steps every single day. You won't start out at 10,000 steps, but if you're starting out at 3,000, mark it on a calendar and tell yourself the next day you can do better, setting that ultimate goal at least 10,000 steps a day. And again, be conscious of portion sizes, what you're eating at restaurants. You don't have to clean your plate. None of us have signed a contract to be members of the Clean Plate Club. Take half of that restaurant meal home. Now the meal you paid $10 for will only cost you $5 for each of the 2 meals. Just really being more mindful of what you're eating.
All right. Well, unfortunately, we are all out of time. But I'd like to thank our guest today, Julie Schema, who is Certified Diabetes Educator with Mayo Clinic Health System, and Linda Carruthers, a dietitian and nutritionist at Mayo Clinic Health System as well. Great topic, and thank you both for joining us.
Thank you for having us.
Have a great day, everyone, and be healthy.